Hello everyone, Mountain of Roses. Welcome to our subject, the Physical Education and Health 2, with the content of individual, dual sports, and also team sports. So last week we tackled more about what are the common sports injuries, what are the cause of sports injuries, what is an injury, or on how to prevent those types of injuries. So for this topic, or for this week's topic, we are going to understand and determine, or you will learn how to perform the first aid procedure, especially on using bandaging. So before that, or before you learn what are the types of, or on how to perform the first aid for acute injuries, you need first to know what we call the do's and don'ts, or the general tips on how to react, or on how to do if ever you encounter that scenario. Okay, so first is you need to reassure to the victim that you are a qualified first aider. Okay, so by watching this video, I am not saying that you will be a qualified first aider. It is because being a trained first aider needs to have a pleasant time, or a schedule, or a what we call training. Okay, specific time for training, so that you will receive, or you will have an award, or you will be declared or to be called as a certified first aider. And there must be an assistant or assistance came from the health people, or let us say the disaster risk management people, or the personnel that's in charge to train those students to become, or people, or some students to become a what we call certified first aider. Okay, so if ever you are not a first aid, you're not a trained first aider, so much better that you need to call an ambulance. Okay, so second is do call 999 or 911 or 211. Okay, or call immediately an ambulance if ever the injury is very serious. Okay, so the third is that don't move the victim unless it is absolutely necessary. Okay, so if ever you notice that the victim is not in the proper position, okay, you can move the victim, but make sure that the victim, or the part of the injury of the victim will not be touched. It's because the more it will touch, the more pain that will feel to the victim. Okay, and if you don't know what you are doing, you can ask some help to those people that knows how to do those things. Okay, fourth is that do visually and verbally assess the injured person. Yes, it is because you are going to use communication to the victim, so that you can ask him or her, what did he feel, what did he example, or let's just say what did he currently feel that moment, if ever he or she is dizzy, or having a blur vision or anything. And you can ask his the immediate person that will contact, so that you can call that specific family, or the family of that person, or that man, so that there will be a what we call a person in case of emergency. Okay, next will be do practice good personal hygiene. Yes, it's because when you perform, or when you are going to do in an action of performing the first aid, you need the people, or you yourself, needs to be clean. Okay, you need to check your hands if your fingernails are clean, or your fingernails are cut regularly. Okay, so that there will be no infections if ever you perform the first aid. All right, next will be don't forget to remove external hazards. When we say external hazards, those are the cloth that is being pasted from the injury part. Okay, so you can use some scissors to cut those clothes or fabrics, and also remove those, for example, those debris or any kinds of hazardous materials on the environment of the injured person. Okay, for example, there is a trunk, there is a broken glass, so remove those external hazards. Anything that is there's a possibility that a victim might injured, or you yourself as a first aider get injured. Much better to remove those external hazards, so that when you perform those first aid procedure, you are safe and there's no harm. Okay. The lastly will be, do try and take the pain of the patient's mind by talking to them. So by enduring the pain of a certain victim, or to remove, or to not to let them feel the pain, you need to talk to them, okay, so that their mind will focus on the conversation, not on the certain part of the body pain. Okay, it is more important, and it is because you are using connection to the victim to stay them alive, or to stay them alert that they are still in the conscious stage. All right, so these are the do's and don'ts. Okay, so now, what will be the materials that you need to have or prepare if ever you are currently at a situation of performing first aid? So before that, you need to learn first what are those first aid materials. So these are the materials needed to perform, or to engage, or to act, or to perform the first aid procedure. So first, bandage, adhesive tape, gauge roll pads, instant cold pack, elastic bandage, blanket, thermometer, safety pins, triangular bandage, antiseptic wipes, scissors to cut those fabrics. Then you need also to have the emergency contact information, or the medical information for the family members. When the time you are on the situation of a person that is having an injury, you need to use the communication. Okay, you need to ask him his personal details, the person that is immediately to be contact with. Okay, and then you need also these materials when you perform the first aid. Okay, I know that we cannot do, or we cannot demonstrate this kind of first aid procedure, but still, I just want you to remember what are the things that you need to prepare, to find, to buy if ever there's an injured person nearby you, or your friends or families. Okay, so I know that most of you have already familiarized the materials to be need, okay, in performing first aid. So I know that you know what is a bandage, what is an instant cold pack or ice pack, what is an elastic bandage, what is a emergency blanket, what is the scissors, and what is the purpose of the triangular bandage, or these pictures or images that you see in the screen. Okay, so now we are going to go on how to do the procedure. Okay, so first is that what are the procedures if ever a person suffer from sprain and strain. So first for that is rest the injured limb, or any kind of part of the body, or on the leg part, you need to rest the injured limb. Okay, and then second for that, you need to use the ice, okay, and put it to the area where the sprain and strain effect. Okay, you can use ice pack. Okay, that is what we call the cold compress. Okay, and then after you put the ice pack on the certain place where the sprain and strain react, you need to use an elastic wrap or bandage, okay, to make the ice pack steady on the position where the sprain and strain occur. Okay, next, you need to rest the feet or the legs if ever the injury is on the feet or legs, or elevate the injured limb, or example your arms limb. Make sure that it is above the heart position. Okay, so I have here a video demonstration on how to perform the sprain and strain if ever a person suffers from this injury. Okay.
Strains and sprains are common injuries that affect the soft tissues around a joint. A sprain is when a ligament has twisted or torn, while a strain is when the muscle has been overstretched, and a rupture is when a muscle or a tendon is completely torn. There are three things you should look for: pain and tenderness, difficulty moving, swelling, and bruising. If someone has a sprain or strain, you should remember RICE, which stands for rest, ice, comfortable support, and elevation. If someone has a strain or sprain, help them to sit or lie down and support the limb in a comfortable raised position. To cool the area, apply a cold compress like an ice pack, cold pad, or frozen peas wrapped in a towel. Leave the ice pack or cold pad in place, or wrap a soft layer of padding like cotton wool around the area. The entire support bandage around the area to hold it in place. This needs to go up as far as the next joint on each side. Raise the injured area and support it with something soft like a cushion, or in this case, you can use a sling. If the pain is severe or they can't use their limb, they will need to go to hospital. Otherwise, just tell them to rest it and to seek a healthcare professional if necessary. So remember, when caring for someone with a sprain or strain, rest the affected area. Ice will help cool the injury down, give them comfortable support with bandages and padding, keep the affected area elevated, and that's how you treat sprains and strains.
So aside from performing the first aid treatment, we also have here the what we call fracture or dislocation. A lot of students, or let's just say a lot of international or professional players, experience these kinds of injuries, especially if that sport is extreme or that exercises is extreme. Okay? Now, how to perform or how to do the procedure in fracture or dislocation if ever there's a person that you encounter or you noticed suffering from an injuries. So first thing that you need to do is to stop any bleeding. If ever it's a fracture, of course you need to determine if that's a closed fracture or an open fracture. Now, open fracture is you can see clearly in your eye that there's a wound and you can see the bone right away and there's a blood swelling. Okay? Closed fracture, that means there's only a fracture inside your muscle. The bone is already break, and you can just see the uneven form of the specific part of the body. Okay, for example, the arms or the legs. Okay, so you need to stop any bleeding if you notice. Okay. Second is to immobilize the injured area. Do not try to realign the bone if ever that is a closed fracture. It's because you are giving a lot of pain to the injured person. Okay, you are not helping, but you are worsening, or you are making it worse to the person who is suffering from that injuries. Okay, do not try to realign the bone. Second is you can use a splint to protect the injured part of the area or the area where the fracture is currently injured. Okay, you can use a splint to support the bandaging or to support the arm or the injured area of the body. Okay, Third, you need to apply an ice pack, okay, to limit swelling and help relieve pain if closed wound, okay, or cover with gauze roll pads and bandages if it's an open wound, okay. Lastly, you need to call an ambulance or 911 immediately. It's because this injury is not just an injury or acute injury. This will be considered as a severe injury. It's because the blood and the pain, okay, the person that suffers this kind of injury might get pale and might lose his consciousness, okay, and might die if ever he loses a lot of blood, okay. Call an ambulance immediately or 911, okay. And take note that do not do this if you are not a trained first aider. I am giving you an idea, or I'm telling you this, or we are having this discussion so that you will know, or you will let's just say have an experience or knowledge on how to react if ever you yourself or you in your family, si Bako, or you in your friend, or you know if someone experiences this, you will know how to react, okay. So I have here also a video tutorial or video demonstration on how to perform bandaging and the first aid in fracture or dislocation.
A break or crack in a bone is called a fracture. A broken bone that does not puncture the skin is called a closed fracture. But sometimes a bone can puncture the skin. This is called an open fracture. Even if you can't see any blood, the break will have caused some internal bleeding, and the injured person may develop shock. Bones that are still growing, like children's bones, are supple and can split, crack, or bend quite easily, a bit like a twig, but the injury is still very painful. If you think someone has a fracture, you may see swelling and bruising. They may have difficulty moving and have movement in an unnatural direction. The limb may look shorter, twisted, or bent. There may be a grating noise or feeling if the limb is moved, have loss of strength, or see signs of shock. If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound and not over the protruding bone to control any bleeding. Call 999 or 112 for emergency help. While you're waiting for help to arrive, don't move the casualty unless they're in immediate danger. Support the injured area. For example, fractures on the arm can be secured against the body with a sling. A fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock, but do not raise an injured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, pad and support the injured area, use a sling or triangular bandage to keep it secure, cover any wounds, call 999 or 112. And that's how you treat someone with a fracture.
So that is the fracture and dislocation, or how to do the procedure, or on how to do the first aid treatment for the fracture or dislocation. Now, we have here the fifth one, or the last one, the concussion. Concussion is one of the considered as the worst injury in playing sports because it reflects, or it affects the head part of our body, or the important parts of our body, the brain. Okay, so if ever a person experience these kinds of injury, you need to apply immediately a cold compress to the injured part. Okay, if ever there's a blood or swelling. Okay, the purpose of the cold compress is to reduce the releasing of blood, or to reduce swelling. Okay, if ever you encounter this from your friends or anywhere, you need to call immediately a 911 or an ambulance, okay? So that that person will be still alive. It's because this concussion injury, there's a lot of people or players who already died because of these injuries. It's because we all know that the brain is the most important part of our body. Without the brain, we cannot live. Okay? So I have here a sample video or a video tutorial or a video discussion that will help you experience or have some knowledge regarding with the symptoms of this injury, concussion. Okay?
Now we're going to talk about one of the most serious injuries that can happen, and that's called a concussion. It happens when the brain inside the skull moves because of an abrupt stop or a striking of the head, and the brain literally slaps the inside of the skull. Coup is one direction, contra coup is the other. And in serious head injuries, that abrupt stop can basically shut the brain down so fast that the patient falls unconscious. That is an automatic 911 call. Even if they begin to recover afterwards, it's still a 911 call because that type of traumatic injury is bad enough that it could develop into a life-threatening issue. But in this scenario, let's say that he did not get knocked unconscious. Let's just say that this player might be feeling other signs and symptoms that could indicate they have a mild to a severe concussion. So one of the first things that they might indicate is that their head hurts. That's pretty common, they just hit it. But one of the other things we want to check for, can you look at me? Can you look right at my nose? Is can they follow your finger? Are they able to track with their eyes? Try to hold your head still and just watch with your eyes. There you go, that's good. Can you see me clearly? Is it nice and clear? So blurred vision, that's an indicator that there might be some swelling in there, so we want to watch for that. We're also going to check for dizziness, loss of balance. He's kind of listing off to one side or the other. Or when I looked into his eyes, I could see that his eyes, he looked like he just came off from like a merry-go-round, where his eyes are kind of trying to track with me, but they're going around and around. That's an indicator that they may be dizzy and not being able to keep their balance as well. I'm then going to move on down and look for signs of nausea or vomiting. They might also have a loss of memory where they're just not sure what they were doing. You know, where am I? Do you know you were playing soccer? Soccer, why am I at the soccer field? So they might have this acute loss of memory, which is another indicator of a pretty serious concussion. If any of these signs and symptoms are present, dazed, confused, all of these put together, we're going to call 911 and get the ambulance on the way. This is a situation where, though it might be a mild to moderate concussion with no life-threatening issues, we don't want to take any chances. If we're going to make an error on the side of the patient, get them into the ER and make sure we get them checked out. This is a child that's going to need to be monitored for the next 24 hours to make sure we don't have any progressive issues as the swelling might increase and the symptoms become worse. The goal is that the symptoms are already present and they're going to get less and less. That's the idea. Now make no mistake, and this is a big issue right now nowadays, if this child has any one or more concussion symptoms, they are not to go back to work or play until they get a clean bill of health from the healthcare professional that states that they've been symptom-free for X amount of time and now they can go back to play.
So those are the 5 common injuries that might encounter when you perform sports, exercises, or exercises. I am not telling you, I am not discouraging you to perform an activities like this or playing sports or doing an extreme exercises. You just need to follow what is the correct procedure on how to prevent injuries. You need to be safe all the time. You need to choose a certain sport that is safe in your part. And I'm not telling that sports are dangerous, okay? If ever we are moving and we cannot control what we are doing, there's a big possibility that we encounter those injuries, okay? Well, it is better to perform sports than to become a sedentary person. Remember that sedentary person is a person that is not having an exercise every week. Okay? Sedentary person is not a physically fit person. Okay? Aside from us, that we are performing at least 60 minutes in a week. Okay? So remember that when you perform an exercises, we need to be safe. We need to think wisely, or we need to check if the environment is safe for us. Okay? Do not perform an activities if you notice that there's a harmful things that might get you injured. Okay? So that will be our topic for this week, and hopefully you understand what we are discussing. I am sorry if there's a redundant noises. Okay, it's because I am discussing this video, or I am recording this video spontaneously without editing. Okay, if ever there's an edit, that means introduction lang yun. Okay, but in our discussion, straight ito, walang putol-putol. All right, so what will be your task or performance task for this discussion? So this is what you need to do. You need to create a video performance that perform first or the basic first aid and also bandaging. You already watched the video, the 3 videos that I present to you on how to perform the sprain or strain, how to perform the fractures or dislocation, and how to react if ever there's a person that is suffering from concussion. Okay, you just need to perform the 5, and you need also to perform the bandaging, and you need to follow what are the procedures. Okay, so take note that this performance task is 20% grade rate of your scores in our subject. Okay, and I apologize again. It's because we cannot really perform actually here in school. It's because we are having a new normal system. All right, so it's what we call kuhaan kita ka ng sariling sikap. All right, so hopefully that you understand, and that's all for this week. Good luck for your midterm examination next week, February 8, 7 and 8, and goodbye.